Hi, my name is Kelly Slimp. I'm a licensed and certified speech-language pathologist, currently working in the pediatric setting. And I wanted to make a video for my parents who I'm not able to see right now due to the coronavirus. And I'd like to do one tip each day for 3 different types of language development. So the first one that I'd like to do for a day 1 tip is for my parents with kiddos who are nonverbal. So this is just a day 1 speech therapy tip, and we're going to work on requesting using signs. And research shows us that a sign or a word for a typically developing child has to be heard at least 50 times in order for the child to make the correlation between the word and the object. Let's say if the word was ball, the child would need to hear the word and see a picture of a ball 50 times to make that correlation. So when you're working with children with any type of language delay or communication delay, we're going to need to at least double that. So repetition is going to be the most important part. I like to work with concrete action words because it is something that should click faster than an abstract word such as please, which can be used in a variety of settings. And so the first sign that I'm going to recommend that parents can target during the week is going to be eat. And you can do any type of variation. And the importance is you want to give your child an option once they've mastered one request. So every time you're just going to model it for them. So little Johnny's getting hungry. You look at him, you might say, "Oh, are you hungry? You want to eat?" And really exaggerate, make your face excited. And so if he gets excited about it, follows you to the kitchen, you want to grab him a snack, maybe like 1 goldfish. That's the key here, is multiple repetitions, at least 50 times. Again, for typically developing children, so up to 100 times is what we're going to recommend here. So we get him 1 goldfish, we hold it next to our mouth so that the attention is at our mouth, and we're using the sign. So, "Oh, eat, here you go." And you can give him 1 goldfish. If he looks at you like you're crazy, he wants more goldfish, you just pretend like you didn't know. "Oh, more eat?" And then you give him another goldfish after you've modeled for him. Once your child masters, he's hungry, he looks at you and he signs eat, give him more, because we do a little, we get a little, but we do a lot. We do it independently, we do it spontaneously. That's showing that he understands and that he's made a lot of progress. So step 2 is going to be making a choice. And again, we want to use concrete objects here. So after your child has mastered eat, we might say, did you want water? And we're holding a cup of water. So if you're able to do this, we want to get a cup of water, hold it next to your mouth, and model the sign for water. So water, and then now we're holding our milk and we say milk. And we kind of do this, and we hold each object next to us. Hopefully the child's able to maintain attention for about 10 seconds, which is what it might be to make the entire, the request to where he's able to respond. And so we want to say, milk. Again, you're holding it next to your face and you're signing, and you're holding a different cup with milk in it. We're not just saying milk, which is, magically in the refrigerator. We have to have that object ready to go. Or water. And you could say Wawa, depending on your child's development. And you're giving them an option, and whichever one they do, the most important part, and whichever one they make the response towards, let's say your child does some sort of approximation, it's important to take the approximation so that your child feels successful. But whichever one he chooses, you could take a point if that's what the level that your child's at, and if he's choosing between the 2 and he's pointing, that's fine as well. And whenever he chooses the milk, you could say, "Yes, milk, you chose milk," and give him the milk. And again, model the sign so that maybe next time he would be more likely to do it. So you're praising him for making a communicative attempt, which is the point. And if he does any type of approximation for milk or water, we're gonna go ahead and give him that. So if he just does this for 1 second, we say, "Good job, here's water," and give him the water. But we don't want to over prompt. So we just want to choose 1 thing per day that we can target. And then only when the child's highly motivated, we're not walking around all day offering milk and water. We kind of want to wait for him to initiate, because that is the truest form of communicative intent, which is the most important part is, does the child understand that I need something and I need to communicate my needs, other than throwing myself on the floor and tantruming or waiting for mom to guess what I need, or having mom fulfill the need before I ever need to communicate that I need something. So again, eat is a great one. You could do water, you could do milk, and then also if you're building a tower, if your child's not motivated by food, you could do help. And again, that's kind of a difficult sign, so what we want to do is make it a little easier for our small friends. And I would just take this, oh, help, oh, mama, help. And we want to keep language to, 1 or 2 words for our nonverbal friends. And so that they're making that correlation. Your child's frustrated, and the important part is letting your child get to the point of being frustrated. So, oh, here's mama, mama, help. Good job, help. And you could model that sign for your child. And then maybe the next time you prompt it whenever your child's frustrated. And then hopefully after, again, 50 repetitions, your child starts to pick up, wait a second, every time I do this, mom comes over here and helps me do what I need her to do. If you have any questions, leave them in the comments, and I'll be doing a day 1 tip for minimally verbal children next.